We have lived in Alma, Arkansas since I was 4 years old. We have 4 beautiful children. Our first daughter is Briella. Our second daughter is Olivia. And our third daughter is Aria. And our son, our only boy, is Daxtin, and he is now 6 years old.
Daxtin is pretty much a spitting image of me. He wants to be the life of the party, just as an absolute bundle of joy.
He is the center of this family because he is the very first boy that was born. So he is the light of everyone's world. We were so excited. We did a gender reveal here in the house, and I got one of the little confetti poppers, fully expecting for pink confetti to come flying out for the 4th time for us.
Oh my goodness. Just pop it.
We could not have been happier to see that blue and then see him on that ultrasound and know it was for real. We were getting our boy.
Yes, so life was great. I was still probably in quite a bit of shock or awe knowing that there was going to be a boy in our life and running around.
We stayed in this just complete bliss for over a year. We took Daxtin to his 1-year well baby checkup with his pediatrician, Dr. Mark Lovell, and he said, you know what, Amanda, his spleen is pretty enlarged.
So I'll never forget Amanda calling me and giving me the news.
And I was standing here in the kitchen at 4:45, and I get a call from Dr. Lovell himself, and he said, Amanda, I don't know another way to tell you this, but Daxtin has leukemia. His white blood cell count was over 68,000. My name is Amanda, and my son had JMML.
The most common symptom in JMML is a markedly distended abdomen. The spleen, which is normally protected by the rib cage, becomes much larger when all of the blood cells leave the blood vessel and actually enter the spleen. These children often present with a general malaise due to all the symptoms that infiltration of the spleen, the gastrointestinal tract, the kidney, or the lungs.
Early on, we realized that really nobody was for sure with what was going on. They knew he had some form of leukemia.
I finally ended up getting in touch with Dr. Stieglitz in San Francisco, and he explained to me that Daxtin was actually only the 3rd known case he had ever seen of the type of JMML that he had.
The concept of rarity becomes irrelevant to any individual family that has a diagnosis. When a child is diagnosed with JMML, it becomes that family's entire universe.
They wanted to try some other forms of therapies and some other treatments before they just went straight to, hey, let's go to transplant.
Ready, go.
This is an incredibly aggressive disease. If JMML goes undiagnosed or untreated, unfortunately, approximately 90% of those patients would eventually die of their disease. Unfortunately, he did not respond to any of the conventional therapies available. Precision medicine means looking at the DNA and the changes within patients' cancer cells and choosing the drugs that are most likely to work for that individual patient. We have done just that in JMML by repurposing a melanoma drug that was typically used in adults, and now we've used it in children. After just a few weeks, his spleen side reduced back to normal and his blood counts also improved. And I relayed our advice that Daxtin proceed to stem cell transplantation.
And I was like, well, the only known cure is a bone marrow transplant.
This is a very difficult decision in terms of picking a donor.
And I was like, I just know in my heart, I was like, Aria is his match. I've known there was something about her, something spiritual about her from a very, very, very early age.
So they brought us all in a room at Arkansas Children's in Little Rock, and one of the physicians called Amanda, and I'll never forget her whenever she said, "Hey, we've got a match and it's Aria," and Amanda and I just bawled. We absolutely cried going down the interstate.
It was one of the most beautiful days we experienced this entire journey. The thing that really threw a big kink in all of our plans was the day that we had to go to transplant. It was the day the entire world shut down for COVID.
And so Amanda would be during day shift and I would take night shift.
So here we are, we're at day 0 is what they call it. So they bring in this bag, a bag you're donating blood in. And I tell people all the time, you've never known true spiritual happiness when you see a bag that your daughter donated the day before drain into your son that is going to give him new life.
The early stages of the transplant, all things actually went pretty well. Over a couple of days, Amanda and I started noticing that he took a turn.
Daxton's getting very lethargic. He is ballooning up, and they keep saying, this is normal, this is normal.
And so somewhere along there, Amanda, I'm not gonna say convinced, how about demanded? How about that something needed to be done.
And I'm like yelling. I'm like, what are y'all doing? You have to do something. He is dying. And they were like, he's really not. I promise he's gonna start releasing this. And I'm like, nope. I've listened to that for days. I'm not listening to it anymore. You need to do something.
I remember feeling like the earth moved out from underneath me, standing there.
And they were like, you know what? We have taken x-rays and his body has no room to breathe. Like, we're gonna have to put him in a medically induced coma, put him on the vent. Okay, we have to help him.
As a father of a 3.5-year-old daughter, I can only imagine what families are going through. He had so much fluid on his lungs that he actually required to be intubated, and his doctors had to breathe for him.
I knew that I was just hours away from Easter Sunday. That represents the day that, Jesus came back to fulfill his promise. And I was like, God, I'm not about to beg for my only son when you gave yours for our entire family. So I thank you, God. I thank you for this little boy that you gave me for 2 whole years. He was more than I ever dreamed he could be. Went back and was just sitting with him, holding his hand, because I knew at some point, they're gonna turn these machines off. And there's this doctor that came in that we hadn't seen the whole time. And he was like, if it's okay with y'all, there's one last thing we can try.
We had an ICU doctor come in and goes, the best thing I know to do right now is to literally put a hole in him with the tube to try to see if we can get that fluid off of him.
And he's like, it's gonna be very risky.
There weren't words at that moment. We'd convinced ourselves that we probably weren't gonna see him alive again. And within probably 5 minutes,
the doctor came in and he said that they had already released 1.5 liters off of his stomach, that he was starting to look like a normal little boy again. This was beyond a miracle. What are you doing, buddy? What are you doing?
Thankfully, Daxtin recovered from all these side effects. After 4 years of being in remission, I'm very confident that Daxtin is cured of his JMML.
the doctors who dealt with this, who'd still deal with this day in and day out, literally referred to him as the miracle baby.
Aria was very excited about her role. And there actually was a fight pretty recently, and she reminded him that she saved his life, and he better always remember that.
We now have a blood test that looks at DNA methylation and is able to predict which patients are most likely to be able to avoid the stem cell transplant entirely, and which patients are unlikely to respond to conventional therapies and should be offered clinical trials at diagnosis. This is a story of hope. This is a story of medical discovery. What JMML researchers have learned over the last 2-3 decades is absolutely remarkable.
So, beyond blessed. We still go back and those doctors see him and they're like, I cannot believe how well he is doing. He aces every single test. He is where he should be, height-wise, weight-wise. He's your typical boy now.